Good morning, good afternoon, and good evening to some of you. My name is Tyler Logan. I'm a project coordinator for the Center for Behavioral Health and Justice, or CBHJ for short, within Wayne State University School of Social Work. So whether you're watching from a region within the United States or even outside of the United States, thank you for being here today. Thank you for being here as we kick off the COVID-19 Mitigation Strategies series, specifically for mitigating COVID-19 within county jails. Next slide, please. Today, during our time together, we will begin with a welcome and opening remarks from Dr. Cheryl Kubiak, the Dean and Professor for the School of Social Work at Wayne State University, as well as from Director Matt Saxton, Executive Director in the Michigan Sheriff's Association. We will then hear from Chief Dunlap, Chief of Jails in Wayne County, and Director Jennifer Crusoe and Katie Snow from Wayne County Health Department. My coworker Bianca and I will then begin to present on the 4 mitigation strategies, and afterwards we'll have a brief panel discussion among leading experts in public health, legal, law enforcement, policy, and social services. Finally, we'll end today's event with closing remarks from Dr. Brad Ray, the director for the CBHJ, and Anna Gonzalez, who is a COVID-19 senior advisor with the CDC Foundation. Next slide, please. A few quick housekeeping items. This PowerPoint presentation, along with any other supporting materials, including the video recording, will be uploaded to the CBHJ's website. This is listed here, but it is also behaviorhealthjustice.wayne.edu/coronavirus/community of practice. Please check for updates on this web link later next week. Additionally, staff will be monitoring a Q&A chat for questions. If you look at the bottom of your screen, you should see the Q&A button here. The general chat feature is not enabled for this webinar. However, you may enter questions within the Q&A chat box as they arise, and we encourage this, especially for the panel discussion later. Our team will be working behind the scenes to pull questions that are reoccurring in the chat, and then we'll use these questions to facilitate dialogue amongst the panelists that we listed earlier. And then lastly, there is a brief post-webinar survey that we would like everyone to complete today if possible. This survey that we collect allows us to then help you all and prepare content, resources, and strategies for jails and communities in need, but it'll also help us identify other thought partners in this space as we continue these series of events. Next slide, please. I will now hand it over to Dr. Cheryl Kubiak for opening remarks. Thank you.
Good morning, and thank you, Tyler. I appreciate the introduction. And on behalf of Wayne State University and the Center for Behavioral Health and Justice, I welcome you to this webinar on COVID mitigation in jails. Our Center of Excellence at the Wayne State University School of Social Work focuses primarily on the intersections between behavioral health and the criminal legal system, with the goal of diverting individuals with mental health and/or substance use disorders to community services rather than confinement. So why, you ask, did we get involved with mitigating COVID in jails? Well, our work in 22 counties across the state came to a halt when jails closed down to non-staff personnel when COVID hit. In the early days of COVID, our home community of Detroit, Michigan was hit really hard. The jail, as Chief Dunlap will illustrate shortly, was no exception to the wrath of COVID. Because of our long-term relationships with the courts and jails in Wayne County and our concern with the welfare of both the staff and those detained, we offered to help. This webinar outlines the strategies we jointly employed with Wayne County administrators to successfully reduce contagion within the jail and the spread of COVID back into the community. Wayne County is the largest county in the state of Michigan, with 3 jails and approximately 2,000 beds. While some may say that strategies in Wayne County may not apply to them and their county, I'd like to counteract those sentiments by saying, if this can be done in Wayne County, it can be done anywhere. None of this would have been possible without the support of the Wayne County Sheriff, Benny Napoleon. We appreciate and honor Sheriff Napoleon's commitment and would like to take a moment to send him positive healing energy from everyone at the Center for Behavioral Health and Justice as he continues his personal battle with COVID. Sheriff Napoleon, get well soon. We all need you. Because of the importance of the involvement and support of the county sheriffs, I'd like to take a moment to introduce Matt Saxton, Director of the Michigan Sheriff's Association. Director Saxton started his tenure directing the Sheriff's Association in March of this year, just as the battle with COVID began. He has provided important leadership to jails across the state, and we are pleased that he can join us today. Director Saxton?
Good morning. I am Matt Saxton, the Executive Director and CEO of the Michigan Sheriff's Association. Well, this morning you're going to have the opportunity to hear from several local officials talking about the mitigation strategies for COVID-19 within a jail facility. And that's COVID-19 testing, contract tracing, information sharing, as well as discharge planning. All four of those strategies need to be adhered to help mitigate the spread of COVID-19, not only in a congregate setting like a jail facility, but as well as in the communities. Wayne State University and the folks at Wayne County Sheriff's Office have been working on this toolkit to provide strategies to jails across the country. The jails across the state here in Michigan already had infectious disease procedures and protocols put in place. But with the COVID outbreak, many sheriffs learned that those policies and procedures that were put in place didn't really work as well for COVID as, say, the normal flu. So the testing process had to be put in place to help the sheriffs control the spread of COVID within a jail facility. Throughout this pandemic, sheriffs have continued to take new intakes into their jail facilities. Obviously, county jails are the first place new arrests are lodged, and those jails had to continue to do the work that they do throughout this pandemic. So sheriffs are continuing to work with the courts to control the total number of beds. At the start of COVID outbreaks, the jails across the state went from 17,000 beds down to about 7,500 beds by the end of April, starting the start of May. And the sheriffs have continued to work with the court system to assure low numbers within the jail facilities during the pandemic. Also putting in play the strategies that you'll hear about. We thank you for taking your time to participate in this webinar this morning as we hear information on mitigation of COVID-19 and jail facilities. Thank you.
Thank you, Director Saxton. Really appreciate your comments and your support of these important battles we're fighting. Finally, I want to acknowledge the many hands involved in making this project a success. As the saying goes, it takes a village, and this project is no exception. First, our partners within the university at Wayne State, the law and the medical school particularly. You'll hear from our colleagues later on in the panel discussion. The Third Circuit Court and Judge Kinney. The funding from the CDC Foundation for this webinar and the Community Foundation and the Michigan Justice Fund that allowed for the mass testing and the work that we've done putting together this toolkit. And last but certainly not least are our Wayne County partners, the Office of the Executive, the Health Department, and of course the Wayne County Jail. I'd like to introduce three of these important partners right now that you'll hear from. First is Chief Robert Dunlap, who is the jail administrator for the Wayne County Jail. Jennifer Crusoe from the County Exec's Office, who administers or regulates all of the healthcare within the jail. and then Katie Snow, the disease information specialist within the jail. I want to make a special shout out to Jennifer Crusoe's boss, Janelle Allen, who was a formidable partner in the beginning of these strategies. Without her, I don't think we would have gotten this off the ground. So I will let the three of them talk about the story in Wayne County, and thank you all for being here.
Good morning, and thank you, Dr. Kubiak. I first want to start out. My name is Robert Dunlap. As you heard, I am the Chief Administrator of Jail and Court Operations here in Wayne County, Michigan. And under the leadership of Sheriff Benny Napoleon, I want to start out by saying thank you to Dr. Kubiak and all of her team. I'm going to share with you just some of the challenges and now what I believe are successes that we have experienced here in Wayne County, and due large in part to, as you heard Dr. Kubiak say, when this pandemic hit us, she reached in and said, hey, what can we do to help? And because of that help, I believe, we're in a good position here in Wayne County to further mitigate and combat this very, very aggressive virus. So the Wayne County Sheriff's Office, as you heard, is the largest jail in the state of Michigan. We operate 2,900, just short of 3,000 beds, 2,951 spread across 3 different jails. We're budgeted for just short of 1,100 employees. However, prior to the pandemic and now, on any given day, we're often 200 staff short in the jails, and that's due to some of the challenges that many agencies have experienced even prior to the pandemic related to hiring and retention. Our average daily population when the pandemic started was hovering right in the neighborhood of 2,050 people, and that was with about 600 people out in the community on community supervision through our electronic monitoring program, which we call Tether, and about another 1,400, 1,450 in custody. On March 10th, when this pandemic hit, as we all know here in the state of Michigan, our governor declared a state of emergency. And I remember very vividly the conversation that I had with the sheriff, who called me into his office and he looked and says, Robert, didn't say, Chief, we need to get ahead of this. He said, this is something like we've never seen, and we need to do all we can to protect the staff and the inmates. And so he directed that I reach out to all of our national, state, and local counterparts, other jails, prisons. And as you heard Director Saxton say, that was even challenging because almost every organization that we contacted, from the American Jail Association, American Corrections Association, NIC, National Institute of Corrections, Michigan Sheriffs, the one thing that we heard consistently is here in jails, we've always had infectious disease protocols, treated like the flu, the sanitation, isolation, and quarantine, treated like SARS. However, as we now know, this virus did not yield to those protocols. So we had to do something more aggressive. One of the things we also noticed right at that time, we had about 60 of our staff out sick. Didn't know exactly what it was at that time, reporting flu-like symptoms. We now know that they were out due to COVID. Another challenge that we had, jails have always had personal protection gear on hand and in storage. But as we soon learned, this pandemic wouldn't let up anytime soon, and the supply we had was just not enough. So there were a lot of challenges associated with PPEs, masks and gowns, cleaning supplies, that as we began to run out towards the end of April, the challenges on a national and state level, as our state battled really hard to get funding for that. And then the Wayne County Sheriff's Office, was hit in the worst way. Towards the end of March, lost Our commander of one of our downtown jails, Donovan Collins, 30+ year employee with this agency, very, very well known throughout the community, not just for his work in the sheriff's office, but also his work in the community. Succumbed to the COVID. And as you can guess and imagine, our employees, became even more concerned and more in fear for their own safety. Because certainly this is a virus, we don't know how we were coming in contact with it. But we continue to, issue the PPE, make sure that we had good protocols with people, isolating, social distancing. And then in April, we saw that, we were now at 110 employees out sick. We had limited testing. We were aggressively working, trying to get testing for those that wanted to be tested. And at the time, our county executive, Warren Evans, along with Sheriff Napoleon, and as you heard Janelle say, Janelle Allen and Jennifer and their team started working with our local cities. And then we were able to get testing on a limited basis at the state fairgrounds. And that testing was mainly for those who were symptomatic at the time. And so several officers and staff took advantage of that, but certainly it was not enough. And then the second week of April, we were hit even harder in our agency in that we lost a corporal and two doctors. We lost our medical director and one of the other lead doctors. And so again, the focus was on PPE, testing, and what could we do to mitigate this? Because at the time, even though we started stepping up our releases from jail and the judges placing more people on tether, we didn't know who in our jails may have had the virus and was possibly asymptomatic and was further spreading it. And so in stepped Dr. Kubiak, some of her colleagues, and through their help, working, as you heard, with the Community Justice Foundation, some of our friends at Hudson Weber, which is another philanthropic foundation here, and Mr. Willie Brooks, I have to acknowledge, of our Detroit Wayne Mental Health Integrated Health Authority, which is our county public health, and one of his directors, Andrea Smith. We made connections and we were able to get funding for testing for all of our inmates. And so with the help of Dr. Kubiak and her team, in the month of May, from May 6th to 8th, we did mass testing. At that time, we had approximately 830 people in custody, and we were able to test in 3 days, both nasal and serology antibody, over 800 inmates. And to our surprise, we found about 78 people who were either COVID positive or had the antibodies, a combination of both. I believe the breakdown was somewhere about 57 that were COVID positive, and the remaining 23 or so had the antibodies. Even though that's quite a bit, we certainly expected more than that, but we were happy that it wasn't more. In addition to the mass testing, we were able to secure funding for ongoing testing, which we currently do today. So one of the challenges, though, was we still didn't have enough testing for our employees. Also during that same time, Dr. Kubiak and her colleagues were able to set up on-site testing at our jails for 3 days for employees. And the lines filled up and we were able to test at least 300 employees during that time. And we were pleasantly pleased that not more than 30 or 40 employees tested positive. But nevertheless, had we not had that testing, imagine how it would have continued to spread had we not sent them home to isolate. So in June, our Chief Judge, Tim Kinney, our Wayne County prosecutor, and our defense bar, they have been working with us from the end of March all the way through till yesterday. We were on a call looking at every person in our custody to identify who had health issues that would make them a greater risk to contracting this virus, and based on a certain criteria, who could be released. And so that process started twice a week, the month of March, April, May, all the way up to June. And in June, our numbers start to level off in terms of employee positives. However, in June, we were up to 208 employees out COVID positive. The judge issued a court order mandating mandatory testing for all incoming inmates to the Wayne County jail system. And so on June 8th, we began testing with the help of Jennifer Crusoe and her disease specialist led by Katie Snow. And that process, as we look, started to pay off in that for the months of, I would say, August through October, we actually had almost no positive inmates or employees in the Wayne County jail system. And today, we currently have 2,700 people in the custody of the Wayne County Sheriff's Office. As I mentioned at the start, we had 2,043 on March 10th, and today, 2,735. And so you ask, why so many? Well, actually in custody, we only have 1,800 people, and we have another 1,700 that's out on electronic monitoring. And so basically what we did was we flipped our jail, whereas there's more people remotely in custody than those that are contained in those tight spaces of the jail. And we believe because of these combined efforts of all the elected officials around the county, we're enjoying some of the successes that Jennifer and Katie will tell you about in more detail shortly. Jennifer.
My name is Jennifer Crusoe. I'm the Director of Clinical Services with Wayne County. And I want to start out by recognizing and thanking the Wayne County Executive Office and giving a special shout out to Janelle Allen, the COO. I believe without her efforts in securing testing and just working tirelessly to secure resources and our project resources for getting DIS in the jails, especially, we'd be in a really different place here right now. And she's really persisted and coordinated a lot of the efforts here for this project and secured partnerships that we probably wouldn't have without her. So I wanted to thank her for everything she's done for this project in the jails. I also wanted to thank Dr. Kubiak for all she's done and her team as well to get us the resources we needed for the project. I wanted to introduce, I know a lot of people on this call and a lot of individuals attending know the importance of disease intervention specialists, especially in HIV and TB programs across the country and how they're used. But I don't think they're utilized in ways that they could be in correctional facilities. So when I heard about how they could be used in this unique position that we were in with testing and the COVID testing project in the jail, I knew that disease intervention specialists would really make a difference here with this testing project. So I just really wanted to focus on my presentation in the few minutes that I have on really speaking about how much of a difference the disease intervention specialists make in the jail in this testing project. I believe that they're a critical part of our team here. They really make a difference as far as speaking to the inmates, getting the inmates to understand how important it is to test for COVID in the jail, how important it is to understand what their results mean, how important it is to test for antibodies, how important it is to interact with the disease intervention specialist. I'm going to allow Katie to explain our low refusal rate for COVID testing, which is pretty remarkable considering our what we are at right now as far as refusal rate. I think we're under 1% or 2% right now, which is unbelievably low. But I think the disease intervention specialists are able to speak to inmates in ways that maybe officers cannot, and they're detached from the officers. So that makes a really big difference. They're able to communicate with inmates. The contact tracing is just so much easier for disease intervention specialists. They interview inmates in ways that, individuals that are from other backgrounds are unable to. So I think that other facilities and other counties could really benefit from utilizing these DIS. And I really wanted to take my time today to focus on that. And I know I don't have much time, but that's what I wanted to focus my time on today. So I am going to hand it over to Katie and have her talk about our low refusal rate on the COVID test. And that is going to also talk about DIS because they're a big part of that. Go ahead, Katie.
So early on in our testing, we learned there was a few things that were key to keeping the refusal rate low. The first one was giving the inmates the ability to refuse testing. And the second was giving them the ability to ask questions. Our DIS start every encounter by explaining to the inmates that they have to consent to testing. We're not going to sit on them and swab them. We have to have their okay. We give them two choices though. And the first choice is that they test. And then in 48 to 72 hours, once we have their results, we can move them into a different housing area. Their second choice is to refuse. But we make it very clear that they can refuse. However, we will come back and see them every day for the next 14 days and ask them if they would like to be tested. Apparently, seeing me for 14 days straight is enough motivation because this is when most inmates will consent to testing. Very few inmates have actually made it the 14 days of denying every single day. I think since we started in June, we've had 12 inmates that denied testing for the whole 14 days. I think it's also really important is that when a patient enters the jail and they're in the process of detoxing, they're most likely going to refuse testing for the first 2 to 3 days. But once they've kind of cleared a fog in the detoxing process, they're more than willing to be tested. So I think the key with our low refusal is persistence, persistence, persistence. And part of that persistence is understanding why these inmates are saying no, why they don't want to consent to testing. So to respond to this, we took an approach where our DIS are not viewed as an authority as the corrections officer may be. We speak to them as if they were family. And in some cases, I speak to them just like they're my kids. We try to understand why are they saying no. The number one question or fear that we get from inmates is that we are actually giving them COVID. So we explain the process, we show them the swab, it's packaged, it's dry, they understand how results are going to be given, they understand how the testing will work, and like I said, very few will still say no. We create a consistency with the interaction that we have with the inmates. The same DIS that collects the sample and interviews the inmate upon new booking will be the one that interviews or gives them their results later on. And sometimes when they're rebooked repetitively, they see the same people so that it builds a rapport and a relationship. So these are the most important steps that we have found with keeping our refusal rate so low within the Wayne County jails. So staff testing was another key that we found with regard to controlling COVID. We found that we can control the movement of inmates, but controlling the movement of officers was far more difficult. So we focused on the things that we can do, making testing more available, giving the officers every option to get tested, educating officers on the correct mask, the proper way to wear a mask, the proper masks to wear, hand hygiene, social distancing, screening the staff before they enter the jail. There's a little questionnaire, travel, how do you feel? Everybody who enters the jail gets their temperature taken. If an officer does happen to test positive, we do a really thorough contact tracing of what staff and what inmates did the officer come in contact with. If the officer worked on a housing unit, we quarantine that housing unit for 14 days and we get all of the inmates tested just to make sure that there is no infection that could possibly be traveling around the jail. Since March, we've tested a little over 2,800 officers. 241 have tested positive. So I think we've done a really good job.
I don't have much else to add to that. I know I do want to talk about our flu vaccination. We did vaccinate many of the inmates in October. All inmates were offered vaccinations, I believe in the second week of October. And Katie hit on the DIS and the importance of DIS in terms of our low COVID-19 test refusals. And I think that about sums it up for us. And Chief Dunlap hit all the other important points in the timeline. So I think that sums it up for us.
Hello, and thank you for joining us today. My name is Bianca Birch. I'm a project coordinator here at the Center for Behavioral Health and Justice at Wayne State University. So the first strategy just discussed in the toolkit is testing. This strategy is fundamental in mitigating the COVID-19 virus, specifically in jail settings. So today I will share some factors to consider before implementing testing within a jail facility and share some more specific information on the different types of testing that is currently being used. And before we dive in, one important note I did want to share is that Wayne County started testing before the governor's mandate was issued. They have stayed on top of it from day one. Next slide, please. So there are some variations on how testing is administered, such as available staffing, both jail and health personnel, the surrounding community, and the jail's current COVID-19 rate. Understanding these variations in testing types, modes of administration, and what has been implemented in other jails will help you develop a strategy for your county that works not only for your staff, but visitors and those booked into the jail. One important factor to highlight is the CDC's recommendation to not administer more than one test within a 24-hour period. Even if a person has moved from one facility to another within that 24-hour period, there's no need for retesting. Next slide, please. So there are two types of testing currently available. The most widely used is the diagnostic testing. The other type of testing that has been used is the antibody or IgG test. I will talk a little bit more about the IgG test in a minute, but first I will spend a little time talking about diagnostic testing and what that looks like. So diagnostic testing helps to provide information on the presence of current COVID-19 infection and can also be used in assessing acute infection as well. Current diagnostic testing is administered via nasal or throat swab and saliva. And most diagnostic tests are administered by a health professional. However, home kits are being used and are available to the general public. For diagnostic testing, there are two types. One is the molecular or PCR, and the other is the antigen or point of care test. The molecular test is the most accurate and does detect genetic materials using nasal swabs and saliva. And results from the molecular test can be available within a 24-hour time period. However, that is dependent on capacity and backlog of the testing lab that your facility is working with. The antigen or point of care test detects certain proteins on the surface of the virus and is administered by nasal and throat swab. It's important to note that while the antigen test is highly accurate for positive cases of COVID-19, negative results are less reliable and may need confirmation from a molecular PRC test. So establishing a relationship and having a point of contact with your local health department can be very helpful. And to get additional guidance on testing and help in creating strategies for diagnostic test administration within your facility. So I briefly mentioned earlier about antibody testing or IgG or IgM testing. It's also referred to those as that as well. And this is considered to be more of an option and is more than likely will not indicate a current or active COVID-19 infection. This is only administered by a blood draw and does require a health professional. Essentially, this test is determining past exposure to COVID-19 by assessing antibody production. It should also be noted that this test does not indicate a current or active infection from the COVID-19 virus. Results from this test can be surprising for some if they learn they have antibodies and have no recollection of ever having the virus. So this is primarily due to having been an asymptomatic carrier or having mild symptoms at one point. There is more research currently underway to learn if or how long antibodies may provide protection from COVID-19. Currently, the CDC does not recommend using antibody testing for diagnosing of current COVID-19 infection status. Jails that are only using antibody tests should consult with their local health department to create strategies for administering diagnostic testing if not already done so. And then one of the most important key points to highlight in testing strategies within jails is the staff testing. Some strategies to consider implementing right away are symptom and temperature checks within daily work routines. And then please keep in mind that this would potentially miss the asymptomatic or pre-symptomatic cases. However, developing procedures for reoccurring and consistent diagnostic testing for staff entering the facility can be helpful. Also, minimizing unnecessary contacts, such as moving between quarantine and non-quarantine units. This is critical in helping to minimize the spread and inform staff testing decisions based on access and proximity to detainees. Another strategy to consider implementing within your facility is a broad-based testing procedure following any positive cases that happened within the facility. And then jail facilities should have a quarantine plan in place. If that staff member has come into contact with anyone who is symptomatic or asymptomatic and has tested positive for the virus, they should receive a diagnostic test. So based on updates from the CDC guidelines, it is recommended for staff to home quarantine for a 14-day period as a requirement following exposure to the virus. They should monitor symptoms to make sure that no symptoms have developed or that symptoms have improved within a 24-hour post-fever. And then another important note about the CDC is that they no longer recommend a negative test result as a determination for a staff person to return to work following a positive status. Based on CDC guidelines, if symptoms do not develop during a 10-day period following their first positive PRC test and the person does not receive a second positive PRC test result, quarantine restrictions can be lifted. And then finally, the Wayne County Jail is currently in the process of developing a protocol for mandatory staff testing for all of their employees. In the meantime, staff at the WCJ have been encouraged to seek testing at one of the contracted testing sites within the county every 2 to 3 weeks. Next slide, please. So there are some key considerations to keep in mind. For the sake of time, I will only touch on a few of these and then pose a question to one of our panelists for their expertise and recommendation. When considerations on testing procedures within jail facilities are being discussed, input from the jail medical provider and/or local health department personnel should be included. It can be helpful to have more than one provider available as a way to increase efficiency and timing for test results. And then when it comes to staff testing, creating flexibility in testing times for staff can help in keeping everyone safe. So now I'll take this time to direct a question to Dr. Tina Chopra, one of our panelists. Some jail facilities may vary in where they are with the development and implementation of mitigation strategies within their facilities, while others may be working to update their current mitigation procedures in efforts to further decrease the spread of the virus and in keeping people safe. Dr. Chopra, could you share more on what the recommended practices are for implementing testing in jail facilities while differentiating between diagnostic and antibody testing options?
Sure. Thank you, Bianca. I think you described the various testing strategies in great detail. So I'll touch on the fact that PCR is pretty much the gold standard for COVID diagnosis. It's a pretty sensitive test. It can have a false negative rate, but because we are joining screening as well as testing at the same time, the Wayne County Jail has a very strong screening program, which is coupled with the PCR testing, which is the recommended standard from CDC. And that's what we've been following here in collaboration with the Wayne State School of Medicine. As far as the antibody testing is concerned, it may not be positive in all patients. There can be a lot of variations and can cause more confusion given the fact that this is a novel virus and we don't know how long the antibodies last after an infection. So the strategy of screening and combined with PCR testing is the recommended standard as per CDC. And that's what we've been doing even before the mandations, as you had mentioned. Thank you.
Thank you for sharing this helpful information, Dr. Chopra. I will now pass this to my colleague, Tyler Logan, to talk more about contact tracing.
Thank you, Bianca. I will now dive deeper into the second mitigation strategy, contact tracing. Next slide, please. Contact tracing is a very useful public health strategy that helps us identify and notify anyone who may have been in contact with an individual exposed to an infectious disease or illness, but in this case, that is COVID-19. By providing information about the virus and collecting information such as symptom history and other relevant health information, staff help mitigate the spread of COVID in the community through raising awareness and general knowledge that may inform one's safety practices moving forward. It is recommended that staff who administer those contact tracing efforts have resources and support, as well as training in that space. These efforts should also include all contacts and those that are being traced to have been exposed within an individual within 48 hours prior to them displaying any COVID symptoms, but also 48 hours prior to testing if that individual is asymptomatic, meaning that there are currently no signs of symptoms. Contact tracing efforts should also include anyone who may have been exposed to the virus from an infected person, whether this being a detainee or an individual who works within the jail system. This is important because as Chief Dunlap mentioned earlier, many of us are also aware of this. The virus can infiltrate staff working within the facility because of their engagement within the community and within the jail itself. Next slide, please. There are two key strategies that maximize the effectiveness of contact tracing. The first is facility contact tracing, and many of us may be familiar with this as jails have already begun this practice, but some states have also begun implementing this in some way, shape, or form within public establishments such as restaurants. In practice, this could include a simple screening for individuals prior to them entering the facility by asking if they have exhibited any COVID signs or symptoms. This includes shortness of breath, fever, cough, or loss of taste and smell. This may also be included in the booking process up front as individuals who enter the jail, but also at entrances and security gates for those jail staff personnel. Having separate housing units for the detainees who test positive for COVID-19 and keeping them separated from the non-infected population is very important, because you want to make sure that you're controlling the spread of the disease within the facility itself. And then developing transitional plans for those housed in quarantine units can also help in these efforts. Next slide, please. Thank you. The second and equally important strategy for contact tracing is community contact tracing. Having a system where jail staff can easily collect and share community contact tracing data with key stakeholders such as local health departments is very beneficial here. In Michigan, the Michigan Disease Surveillance System is used by local health departments to record contact tracing data. Jail personnel oftentimes can receive access to the system as well and share their COVID-19 data within the system, and that helps with the collaborative efforts moving forward. This collaborative and system level approach is vital, and it also helps the jail population by increasing the awareness and the data linkages that all agencies work with. But it also helps with higher frequencies due to the data that is being shared amongst individuals. These systems help protect the jail population within the facility, as well as curb COVID-19 rates within the community itself. Next slide, please. I'll breeze through this slide as well, just to catch up to some of the time frame. But this is an example of a contact tracing form that the disease intervention specialists currently use within Wayne County Jail. I know it may be hard to see, so upon receiving these slides, you may also click the hyperlink to the right, and this document is also hyperlinked on the CBHJ's website where the toolkit is currently located. The basic outline of this form includes collecting information that individuals discussed earlier, such as the basic personal information of that individual, as well as the context that they may have been exposed to. And then in addition, this form has booking information and arresting officer information components as well, so that you can also keep coordination and communication with those individuals who may have been exposed upon bringing that detained person into the facility. Next slide, please. Key considerations for contact tracing include, first, using the contact tracing form to collect this needed information. Contact tracers such as the DIS mentioned earlier, disease intervention specialists, they can use this information to then contact individuals and provide this information to them as far as what isolation options may be available, if there are doctor referrals and other needed resources. And then again, having a designated person doing this within the facility greatly assists in managing COVID-19 within the jail setting. Local health departments and health agencies can also assist in contact tracing efforts moving forward. I would now like to ask the Wayne County Department of Health folks, that would be both Director Jennifer Crusoe and Katie, a question. Recently, research has been published highlighting the strengths as well as barriers for contact tracing efforts. For example, privacy concerns and mistrust are common barriers. How has Wayne County utilized the disease intervention specialists or other innovative solutions to address this?
Hi, it's Jennifer. Again, I want to brag about the DIS. I want to say that incorporating the DIS into the COVID inmate testing project has been extremely valuable, priceless. Building trust with the inmates during the intake process is critical. There's a small window of time and the DIS have been successful in reaching the population, even upon release when it is time to do that contact tracing for positive cases. When an inmate, for example, has been released and the DIS has to contact a positive individual upon release, that DIS has been successful in reaching an inmate because of the trust that is built upon intake. We have two DIS, as Katie mentioned earlier in her presentation. The same DIS who makes the initial contact with the inmate at intake and conducts the interview is the same DIS who provides the inmate with the results. And during the planning for this project, that was a deliberate move that was made for consistency and communication between an inmate and a DIS. We all know mistrust of the system is a huge barrier. So being familiar with the success of DIS from Chicago and elsewhere, I was excited to see how it could work here, and it's definitely working. Everything a DIS does here during their interaction with inmates helps in their contact tracing efforts. It's about genuine interaction and persistency. That's what it's about here, and it's working.
Thank you. And Katie, I'm assuming there may not be much to add, but if so, would you like to add anything else?
Nope, Jennifer hit the nail on the head.
Sounds good, thank you. I will now pass it back to my colleague, Bianca Birch. Thank you.
Thanks, Tyler. So a critical strategy in mitigating the spread of COVID-19 within jail settings and surrounding communities is data collection and information sharing. It's necessary to implement processes to capture, record, and share information as you develop procedures around strategies like testing and contact tracing. Data sharing will look different in each jail as it depends on size, resources, and technology available to that jail. In efforts to implement this strategy, some basic steps should include identifying a person or small group of people that will be responsible for the daily data collection and management. In Wayne County, these identified persons were the disease intervention specialists or DIS workers that worked closely with individuals entering the jail and gathering the information at booking. Ultimately, this information will be shared not only within the jail, but with local and state health departments. Next slide, please. So I will spend a little time talking about some key points to consider when looking at sharing data to help drive decisions. Results from a diagnostic test may occur at varying times based on established policies within the jail. With guidelines that have been laid out by the CDC and local and state governments, implementation of testing should be done at entry into the jail and have routine testing of staff. Designated staff, such as a DIS worker, should record the date testing was done, which test was administered, and the date when results were received for each individual. Also, any mitigating circumstances or refusals that prevented testing should be documented. So tracking prevalence over time can provide jail administration with timely warning signs of when mitigation efforts may be implemented or reduced. Any changes in community COVID-19 prevalence should be monitored to help inform jails for altering mitigation efforts as time goes on. Next slide, please. So the inclusion of public health at the state and local levels is important as they can help in tracking positive cases in an attempt to determine community prevalence and sharing preventative efforts. Remember, a positive case detected in the jail is not only cause for concern within the facility, but also is a public health issue. This means that individuals in the community have also been exposed. So routine practices for sharing information with the health department should be implemented as an act to connect jail mitigation strategies to the broader public. And then knowing and having a record of your results is important. It is recommended that jails share paper copies with all justice-involved individuals and those who have been released prior to receiving test results. This could include positive and negative results, as well as diagnostic or antibody tests, should receive notification via phone, text, email, or mail. Effective communication may help to decrease individual anxiety and mistrust between medical professionals and communities. Jails may implement requirements for routine testing of staff, and jail administration may require documentation of that testing. And it's important to note that because testing labs are required to report any positive test results to the state, the assumption will be made that contact tracing efforts and disclosure of the employee will activate prevention and intervention measures within the jail. Next slide, please. So let's do a quick recap of items to consider as key strategies for information sharing in mitigating COVID-19 within jails. Information should be collected for all individuals being detained and booked. Information collection should also include testing results. So identify a person or people who will be responsible for the collection and management of all data. And then any personnel implementing COVID-19 risk reduction strategies and protocols within the jail, whether they are public health workers or other designated staff persons, should have computer literacy skills, data management experience, public health knowledge, be culturally competent, humility, and have some motivational interviewing skills. And finally, collaborate with local and state health departments in efforts to make data-driven decisions. So now take this time to direct a question on information sharing and public policy to two of our panelists, Lance Gable and Heather Walter. Many jail facilities have implemented soft mandates for inmates to be tested upon entering the facility. Jail facilities have also begun testing staff. Lance, should an employer implement policies that mandate jail staff get tested for COVID-19, as well as share their results before being allowed back into the physical workspace? And then for Heather, if you could also share a little bit on how this is, or can you speak to this for unionized employees? Sorry.
Thank you, Bianca. It's a great question. And as to whether or not the employers should be requiring the testing, especially right now with the case rates being so prevalent in many communities, I think it is a good policy, and it's one that's supported by the law. In other cases of infectious disease, it's been pretty clearly demonstrated that it's consistent with legal requirements for employers to allow or to require their employees to be tested. And the same would be the case with COVID-19 tests. Obviously, these tests have to be done in an objective way across the board. You can't target only certain employees. It should be a policy that's applied consistently and not based on someone's underlying perception of someone's disease status. Otherwise, there could be concerns about discrimination under the Americans with Disabilities Act. But as long as the testing is being applied consistently to the employees, that's something that would be legally permitted. Also, sharing that information and requiring either a proof of a test that shows someone is not infected or other information that would indicate it was safe for that person to come to work could be required as well. We want to make sure that these workspaces are safe, not only for the employees, but also for everyone else in the facility.
Lance.
Thanks, Lance. And I think one of the important discussion questions here is around unionized employees, since many of the folks working in this area do operate under a union. Any discussion of mandatory testing of unionized employees should begin with an examination of the collective bargaining documents. The management rights provision and the power granted will determine if any changes can be made without further bargaining discussions with the union. If the power is not contained in the management rights provision, it's important to immediately contact the union representation and explain the desired change and the public health importance of the change. It will be critical to be available for quick discussions with union leaders. And even if the power is contained in the management rights provision, it's advisable to approach the union for discussions prior to issuing a rule for mandatory testing. From a public health perspective, it's important to get buy-in in this decision to increase willing compliance.
Thank you for sharing this helpful information, Lance and Heather. I will now pass this back to my colleague, Tyler Logan, to share more on discharge planning.
Thank you, Bianca. I will now end this last mitigation strategy section on our last mitigation strategy, discharge planning. For those who may not be familiar with this process, discharge planning is the transition of a patient's care from one level to another. So essentially, this is care coordination for those re-entering the community. Next slide, please. Discharge planning is important because this provides individuals who re-enter the community with the necessary resources that they may need to be successful. Due to the pandemic and risk factors of COVID-19, discharge plans should be managed remotely when possible. This also creates a collaborative platform and more flexibility for the community providers that are oftentimes a part of that process. Discharge planning supports may include, but are not limited to those listed below, and that includes transportation, clothing, food, financial and employment resources, and other support systems. Next slide, please. Key considerations for discharge planning include reviewing the current discharge planning process and procedures to establish strategies, creating alternative plans to conduct in-jail services after doing this initial review, utilizing disease intervention specialists to screen detainees at the booking process and work with community providers to establish warm handoffs, inform individuals of their COVID-19 results, as this not only may increase trust between the detainee and jail medical staff, but it is ethical where possible. And lastly, provide a brief packet of information that shares relevant information, local resources, and COVID-19 information to further prepare that individual as they re-enter the community. I will now ask Chief Robert Dunlap one question. Discharge planning is especially needed during a pandemic, as this provides a warm up to justice-involved people re-entering the community who may also require additional resources, such as behavioral health resources that you mentioned earlier or COVID-19 housing. How has Wayne County shifted, if at all, their discharge planning processes to address COVID-19 implications for those re-entering the community?
Well, thanks, Tyler, for that question. As you indicated, discharge planning is a critical part of helping to mitigate, the spread of this disease in our community. And so as it relates to COVID-19, we have, encountered some challenges that I'm sure others may have experienced in terms of HIPAA, but as you indicated, what the Wayne County Jail does is when an inmate is released, we make sure that that inmate is made aware of his or her COVID diagnosis, be it negative or positive. And if they are positive and they're on other medications, we have a policy in place where they're released with at least a 10-day supply of medication. For those individuals that are released to community treatment providers, that information is shared with that provider as well. And we make sure that there's a warm handoff between the jail and the provider, either via a pickup in most cases, or transportation from jail staff, from the jail to the provider. I realize that there are probably some other communities that may not have those type of relationships, but another resource might be your county public health authority. A lot of these relationships that we have in Wayne County with community health providers also have relationships with the Wayne County Integrated Health Network, which is our county health authority. So Wayne County has been also blessed and fortunate in that this has been a process in place long before the COVID, but I think it's something that can be done, across the country when you look at the resources that are available in your community. I think the key is making certain that, the jail is linked with community providers and then linking those inmates to those providers as well. Because one thing that we know is a lot of these inmates will go out in the community and unfortunately come back, and it's just recycling the spread of the disease if we don't implement these protocols.
Thank you, Chief. Next slide, please. Before I jump into this slide, I want to take the time to remind everyone that you may enter questions in the Q&A chat box if not already done so. Our team will do our best to respond and answer these questions, especially within the panel discussion that is next. However, if we do not get to all of the questions, we will answer them in the follow-up email that will come after this webinar, sometime later next week. Thank you. In the meantime, I can assure you that our team learned a lot of lessons along the way. Most importantly, if we haven't stressed this enough already, collaboration is a key lesson learned. Through collaboration, we were able to build consensus for best practices, understanding everyone's roles and responsibilities, but also to identify the champion in different silos and bring them all together to address this issue as a team, almost like a public health and criminal justice superhero squad. Additionally, providing communication and being transparent with individuals helped all understand and build trust, both with detainees, but also with those community agencies. And lastly, cross-analyzing pre-existing conditions and providing regular access to PPE and other resources is a key strategy in mitigating COVID-19, again, within the jail facility and within the community itself. Next slide, please. We will now have a brief panel discussion with Heather Walter, the Associate Professor of Law and Social Work at Wayne State University, Lance Gable, Associate Professor of Law and Faculty Director at Wayne State University, Dr. Tina Chopra, Professor of Internal Medicine and Infectious Diseases at Wayne State University, as well as Dean and Professor in the Wayne State University School of Social Work, Dean Kubiak. We will also hear from Chief Robert Dunlap, Chief of Jails and Court Operations within Wayne County Sheriff's Office, and again from Division Director Jennifer Crusoe from Wayne County's Department of Health, Human and Veteran Services. When possible, I will direct questions to specific panelists. Each panelist will have 2 minutes to respond to the question being asked. For example, if I ask Dean Kubiak and Chief Dunlap the same question, each of them will have 2 minutes to respond. If separately, it'll just be an individual separate question for 2 minutes of a response option. I'd like to begin with you, Heather. There are some jails that have begun providing incentives for jail staff that get tested for COVID-19. For example, offering flexibility with personal time off, PTO, whereas others administer staff testing through mandates or soft mandates. Can you speak to this and provide any context on when one may be more beneficial over the other?
Thanks for the question. I think that when, I believe it was Katie was speaking earlier about some of the efforts that have been made within jails to work with persons who are needing to be tested to get their willing compliance, and that the repercussions of not getting the testing have been soft reminders daily rather than punishment in some form. We are seeing really good response rates and really good compliance with that. I believe that the number that she quoted was less than 1% refusal. When that's available, historically, public health has been able to use more mandates and tools to require people to do things. But when we're able to get compliance through other ways, such as incentives or soft, not punishments, but soft reminders, we tend to see better compliance and less frustration and anger over having to comply, particularly when we're explaining the reasons. So if it is possible to get the compliance in the way that Katie described earlier, that generally tends to be recommended through public health folks. But when it's not, then we move on to mandates. And I don't know if Lance has anything that he would want to add to that. But that generally has been the case historically, is trying to get that compliance with incentives rather than mandates when possible, but legally mandates are available if needed.
Thank you, Heather. Lance, to that point, what are some of the state or national policies or practices that can help improve testing in jail settings?
Well, I think that, to echo what Heather just said, it's preferable when possible to have these policies be voluntary testing policies. That's likely to not only promote cooperation, but also to ensure that there isn't kind of an obvious backlash or resistance to something that's being perceived as unnecessarily coercive. That being said, the powers exist to do this in a mandatory way if that's required, and if there's widespread resistance despite a voluntary effort, that's something that could be implemented. One thing I will add to that is that I think that the model that's been demonstrated here in Wayne County is a really great model that can be employed around the country and really should be. I don't know to what extent other jurisdictions are trying this same approach, and I don't think this kind of widespread testing program is the norm across the country right now, and I think it really should be. And part of that is going to involve having the resources and capacity to do it. And so it's really important for Congress and for state legislatures to allocate the kinds of resources and funding to support expansion of these kinds of programs, because if we can really expand testing, we're going to be able to detect outbreaks, we're going to be able to prevent further spread, we're going to be able to take other kinds of precautions to stop this disease from spreading within the jail setting.
Thank you, Lance. Dean Kubiak, we'll now shift to you for this question that was asked in the chat earlier. Are detainees receiving the proper resources to reduce their exposure to COVID-19 outside of jail? And I'd like to follow up and ask if you could explain what those proper resources may be. Thank you.
Thanks, Tyler. I think that Wayne County has done a really good job at trying to look holistically at this issue. And in general, Wayne County has resources for people who are discharging the jail in terms of treatment. But they've also moved to explore housing. And housing, as you know, is always a critical issue for those who are discharging from our jails and prisons, and in general in the community. but they've been able to work with several providers in the county that will have beds available, and those beds have been designated as COVID positive. Because if someone is living in a home where they don't have the luxury of having a separate bedroom and bathroom facility, they put everyone else at risk. So having these beds in treatment centers around the county, and some counties have even gone to using hotel beds for this purpose, but that separation or quarantine from who they could infect potentially in their home is a public health strategy that seems to be working very well in the community.
Thank you, Dean Kubiak. I did receive a message from Jennifer Crusoe. She has some alarms going off in her building right now, so I'll direct this next question to Katie Snow. What COVID-19 resources are provided to detainees as they re-enter the community?
When an inmate leaves Wayne County and enters back into the community, they're offered different places that they can get testing. If they need follow-up testing, they're offered different resources on if they don't have say medical insurance, different clinics and things that are available within the community to continue their care outside of a Wayne County jail.
Thank you. And can you also touch base on some of the testing results? I believe are inmates receiving those testing results upon discharge?
It kind of depends on your actual result. If an inmate is COVID positive, we call the inmate and we actually speak to the inmate to explain to them their results and the next steps that they need to take. If they're still in-house, in custody, we actually go find the inmate and face-to-face give them their results so that if they have any questions, we're able to answer those questions right away.
Thank you. Chief Dunlap, we will now shift to you. Your question's a little long, so please, if you need me to repeat anything, let me know. How did Wayne County integrate technology into its COVID-19 response plan, specifically technology that allowed remote communications between inmates and the courts?
So one of the things that we did right away was we shut down all visits. We shut down all non-essential traffic in our jails. And so with the help of some of our vendors, our jail telephone vendor graciously provided every inmate in our custody a 20-minute video phone visit every week. And that allowed us to allow the inmate to stay connected with their family, their attorney, or whoever they wanted to talk to during that week. In addition to the 20-minute video conference, they were given a 10-minute phone call as well. And so we used our video visitation system via inmate tablets that we have in our jails, as well as probably going on all around the country, court movement, all court proceedings started to take place by video. And attorneys would visit inmates by Zoom. And so using the Zoom technology, Microsoft Teams and whatnot, we were able to pretty much eliminate all essential movement within our jails, which also helped us to mitigate the spread and contact of the virus coming into our facility.
Thank you. To that point, Dean Kubiak, can you respond and address the continuity of care for mental health and substance use disorders? Thank you.
Sure. Thanks, Tyler. As I started to say in the beginning, our work is generally around behavioral health and providing access to behavioral health services in the community that would divert people from jail. And when COVID hit, many of the folks who go in from the community mental health or the substance abuse providers could not go into the facility. And one of the important strategies that we also worked on during this period was to try to put technology or greater access to technology inside jails across the state so that folks who were detained in the jails could have continued contact with community providers. This is really essential, whether we're talking about release strategies to decrease population during COVID upticks, or just to manage the anxiety and stress in the jail. This is really a difficult time for those who are working in or detained in jails. There's a lot of anxiety around COVID contagion. People who are locked up wonder, are they going to die in jail because of, they can't isolate. They can't wash their hands as freely as they want. They can't control who is and who isn't wearing masks. So we know that anxiety is high in the community. People are exhibiting a lot of mental health symptoms. This is also true for inside the jail. So I think that we need to think about how do we continue mental health services to those who are detained in the jail, and whether that's through virtual technology like telehealth mechanisms, but to allow folks access to some of those professionals. And I think that that's a really big help for jail management, because as we know, when people get stressed, they act out. And so I think that not only an in-jail management strategy, but also for that continuity of care upon release. Many of the providers in the community have also had to change their practice models, and their doors aren't generally open, and they too are trying to communicate virtually. So these linkages are important as we're releasing people from the jail, as well as maintaining those services while they're locked up. So I just want to underscore that point and say that the same is true, I think, for correctional staff who need support. This is a really stressful time for them as well. They are first responders, they are essential workers. Their level of exposure and unknown exposure, particularly if a jail is not testing, is also very critical to understanding what are the needs in a locked facility. So we have to think about both the people who are detained as well as the people who are working within these facilities, and to think about what are the mental health needs that everyone is experiencing right now.
Thank you, Dean Kubiak. And we'll end with this final question that was received from the chat box. What has worked or not worked with staff testing? Chief Dunlap, if you could speak to that, that would be perfect. Thank you.
Sure. And I think that's a great question. As you heard me talk earlier about when we, lost the, 4 different staff members, right away, people, were very concerned, and, they wanted to be tested. It wasn't a challenge. And we soon, I believe the date is November 2nd, when we were able to implement mandatory testing for all staff. And so every person that works in the Wayne County Sheriff jails and courts is required to test every 2 weeks. What works well is the on-site testing that was made available, again, through our relationships with, Wayne State University Memorial Health, all led and coordinated by our Chief Operating Officer, Janelle Allen. We have on-site testing 4 days a week at our downtown, one of our downtown jails. And then we also have a jail in a suburb, which is in the center of the city of Detroit, called Hamtramck, where we have testing there as well. That convenience has really helped in that the initial testing that was made available to us was off-site. A lot of people weren't taking advantage of it. And the other part about testing was, we had employees who unfortunately were going other places getting tests, and we had no way to verify whether or not it was a valid result. Now our testing is coordinated through the county. And so when an individual is tested, the county gets a notification as well as an employee. And so now we have accurate information that we could use to begin contact tracing. And again, we all know how important contact tracing is, as we've heard, to help mitigate the spread of the virus. So what has worked well is, having it on site, having it coordinated through the county, opposed to it being off site, not coordinated by the county, having real-time good information, opposed to trying to rely on information where that we really don't know the true source. And because of HIPAA, certainly we can't just call those other outside testing sites and say, tell us about this test.
Thank you so much. And thank you to all of our panelists for answering the questions that were asked. If you did ask a question within the chat box and it was not answered, again, our team will work to respond to those in the follow-up emails that will be sent out later. I will now, next slide, please, Stacy. I will now transfer this over to Anna Gonzalez, the COVID-19 Senior Advisor with the CDC Foundation. Thank you.
Great. Well, thanks, Tyler. And this has just been such a great webinar, really informative. And please stay tuned for Dr. Ray to talk about next steps. But I just really wanted to thank all of you. I had the good fortune to be connected with Dean Kubiak and Dr. Ray this past summer. And at that point, they were looking for the type of implementation guide for jails that they have since created and referred to as the toolkit, and that you all learned about today. It's just really impressive to see how much this larger Wayne County group has done together in such a short period of time. So I just want to say congratulations to the group for accomplishing all that you have together. And even more, I want to thank you for your willingness to establish this community of practice where collective knowledge can continue to grow and be shared to the benefit of the uniquely vulnerable populations you support and the communities they live in. Your work has and will continue to prevent community spread of COVID-19 by released inmates or the essential staff who work at the jails. It's just a great example of the power of cross-sector public-private partnership and what it can produce for a greater good. Thank you to the great panelists for your generosity of your time and expertise, and thanks to everyone who turned out and participated. This has been a fantastic start to building a cross-sector community of practice, and the CDC Foundation is just really happy to be supporting it. I hope that everyone who attended will walk away with at least one piece of information that you can use, whether it's about COVID-19 mitigation methods in jail settings, or how to build strong community partnerships, or maybe another area where there's a gap that you know how to fill. I'm sure many of you have important lessons of your own that you've learned at your jails and work environments, and hope you continue on with this community of practice in the coming months so that you can share those important lessons. I know the Wayne County group's interested in growing this community and hearing about how others have approached their challenges. And in looking ahead, I know this group will support and learn from each other and problem solve together so you can keep your inmates and staff safe, keep yourselves and your families safe. And if we all do this together, we'll return our communities and our lives back to normal. So thanks to everyone here for the important work you do every day. And please stay safe and healthy. And now I'll hand it off to Dr. Ray.
Thanks, Anna. I want to thank everyone for coming together today on this important topic. I really want to thank the public officials from Wayne County, Chief Dunlap, Jennifer Crusoe, Katie White, for joining us today. And I want to give a big shout out to Janelle Allen and Dr. Ruta Sharapani, who are not with us today, but were just pivotal in these efforts early on. And I also want to thank my colleagues from Wayne State, Lance Gable, Heather McCabe, Dr. Tina Chopra. We're really fortunate to have national experts like you at Wayne State who are engaged in this topic and trying to help with this community. Also, another individual who deserves a very special thanks is Dr. Phil Levy with the Wayne State Medical School. He and his team went into the jail at the height of the initial lockdown to institute mass testing, which really triggered a lot of the quarantine efforts and ultimately this toolkit. And lastly, I want to thank Dean Kubiak for always helping to build bridges across Detroit to address issues like this. So for everyone that's joining us here today, I want to tell you that this event is kicking off what we refer to at the center as a community of practice, which I would loosely define as a group of people who interact regularly to figure out how to do something better. We had great questions today, but we believe that this conversation needs to extend beyond this first event and evolve along with this pandemic. The vaccine offers hope to many, but experts tell us that COVID is going to be here for many years to come. Many of us believe that COVID is going to persist as a complex social problem in jail settings. So this community of practice helps us carve out a little piece of the internet that we can all share, and also a consistent spot on your calendar. So we're going to be coming together to sharing information the last Thursday of every month at 1 p.m. We want to try and have a flexible curriculum and agenda for that as things change with this pandemic. But tentatively for that January event, what we're planning to focus on are jail settings for public health professionals. So talking a little bit about what those jail settings look like. We'll be bringing new panelists and new topics. If you're interested in participating as a panelist, please email myself or Tyler Logan. We'll be providing our information at the end here. We're also going to be sending out a survey after this event to get your feedback for future events. So please take the time to fill that out. We'll be putting the results of that on our webpage so you can see what the responses were as well. And this website is where you'll also be able to find updates to the toolkit, which we'll be producing next year. Finally, as we continue these conversations, we want to build conversations between individuals. And one of the ways to be able to do that is to interact through the Zoom platform, whether that's in the chat or the question and answer or doing breakout groups. So in future events, we're going to be utilizing more of those features of Zoom to facilitate some of those conversations. I really look forward to continuing this conversation at our next event, and I really want to thank all of you for joining us here today on this very important topic. Thank you, everybody. Have a great weekend.